Chapter 2 Warm Springs Insane Asylum, Warm Springs, Montana, Receiving Hospital. Good day. Bring the child this way, ordered the middle-aged admitting nurse, her smile strained by the repetitive duty. Her blonde hair was wrapped tightly in a bun, and her stout build looked useful for combative patients. She directed the county health nurse down a short hallway into a faded yellow examination room, cluttered with an odd assortment of fixtures. Chairs lined the walls. An examination table dominated one end. At the far end crouched a solitary low desk. 2 rows of dim lights dangled from the high ceiling on the frayed, yard-long cords. Air drifted through a small window, making the lights swing lazily. The sharp, caustic odor of cleaning fluid greeted newcomers rudely. "Here," said the county health nurse, taking a deep breath as she handed over the commitment papers. The stocky receiving nurse glanced at the records, then took Petey and laid him roughly on the cold metal examination table. "Is there anything not mentioned in the report?" "No, except the parents gave him up reluctantly." "Some do," said the receiving nurse. "I've seen farms and businesses lost, busted marriages, even suicide. And you know what gripes me?" "What?" "There's always someone thinking the parents should have tried harder." The county health nurse nodded, glancing at her watch. "I'd better get going. I have to catch the 4 o'clock Northern Pacific back to Bozeman. I have health exams at the high school tomorrow." "Well, give my regards to the outside world," said the admitting nurse, removing the tiny garments from the child's tense body. "Won't be needing these anymore," she said as she wiped down the youngster and checked for cuts, rashes, or sores. "What have we here?" asked an old doctor, entering the room. His wrinkled skin looked a couple of sizes too big for his bony frame. "A youngster, 2 years old," the nurse answered. "Petey Roy Corbin, from Bozeman, raised by his parents. I've cleaned him, and he seems well cared for." "Let's have a peek," said the doctor, bunching his lips as if deciphering a puzzle. "For sure he'll be crib-bound." He glanced through the commitment papers and shook his head. "Parents even had him over to the doctor's in Butte." He placed his stethoscope to Petey's chest and listened, then raised an eyebrow in surprise. "This child has a strong heartbeat. That's unusual for his kind." The doctor ran his hand through Petey's hair, looking for lice and other vermin. Then, tugging on the stiff, branch-like arms and legs, he added, "Spastic." The nurse nodded. The doctor picked up his clipboard and jotted down the word idiot. "I concur with these evaluations from Butte. I wonder what the parents hope for. A diagnosis of imbecile?" Sarcasm edged his voice. "Either way, his lights are out and the treatment's the same," the nurse added. "What treatment?" the doctor mumbled. Later that day, a young attendant from admissions carried Petey to the infants' ward, a large, cavernous room with high ceilings. A dozen cribs lined each wall. Dirty white paint blistered from the walls, exposing a gaudy yellow undercoat that contrasted with the bright white uniforms and beds. Each cage-like crib had high metal sides. Empty space near the center of the room formed a play area, but there were very few toys. The attendant walked down the side aisle, glancing at the deformed young curiosities. One child had no visible forehead, only a hairline that started with his hooded eyebrows. It gave him a caveman-like appearance. Another child had a head larger than a basketball. Many were like the baby the attendant held in his arms, helpless and passive. Several, however, kicked and yanked viciously at the stout bars on their cribs. Of those allowed in the play area, nearly half sat morosely, like banished souls. 2 rolled about on the floor, creating a spectacle of driveling, gyrating bodies. A din of grunts and whimpers mixed with the screams, cries, and wails. The place gave the attendant the creeps, with all the mongoloids, pinheads, hydrocephalics, and the other assorted freaks. Quickly, he deposited Petey in a vacant crib at the far end of the ward and hurried out. Long shadows fell across Petey's twisted little face as the sun settled that first day on infant's ward. Immediately, a pattern of monotony captured his existence, a pattern marked by 2 phases, daybreak and sunset. The metronome of life enveloped Petey with this pattern. In the outside world, life diffused the cadence, but in this place there was no life. The rhythm throbbed, soaking into each patient's psyche. Daybreak, sunset. Daybreak, sunset. Daybreak, sunset. Seasons tempered the pulse, but the pattern remained, repeating over and over and over, numbing even time itself. With the passage of time, absolute and indifferent challenges befell Petey's body. Had years passed like hours, the changes surely would have been noticed. His legs pulled inward like dried roots against his tiny belly. Both arms bent sharply at the elbows and stiffened. With his hands doubled back against his wrists, his fingers became claw-like, like crooked talons with no prey. Petey's head bent farther and farther to the left. His tongue writhed about, snake-like. And slowly a subtle change crept into Petey's eyes. The little spheres, so long unfocused in space, tilted imperceptibly inward, drawing the world closer and closer. One day they wavered, then converged on the ceiling above the crib. A dim light bulb drifted out of a hazy fog and for the first time came into focus. 3 years after arriving at the infants' ward, another giant event went unnoticed. As Petey was given his weekly bath, the attendant lost her footing. Struggling to lift Petey into the large claw-footed tub, she dropped him headfirst into the water. She grabbed him up. "Are you okay, poor baby?" she fussed, dabbing water from the child's eyes with the towel. The towel hid Petey's unmistakable smile. A succession of different nurses and attendants cared for Petey. They found the 5-year-old easy to care for. Unable to complain, he spent each day in his crib, straining his head, gazing about the room. Nobody could read his thoughts, nor could they see the feelings Petey was developing and wanted to so desperately express. All they could see were his fleeting, flickering smiles. Failing to respond any further, his expressions were still dismissed as shallow gestures of an idiot.